Sometimes for children with autism, toileting goes brilliantly and they come out of nappies at 2, but sometimes they get stuck, and this can be a real challenge for families. A lot of young children with autism have an associated learning disability and may not be ready to toilet train at the typical age you would expect. So we need to first of all identify if it's realistic and achievable for that child to toilet train, and then if we think it is achievable, if they haven't toilet trained, look at what the barriers and the problems are. So we know that children who have a wet or dirty nappy that are displaying no distress or recognition or motivation to have that changed are probably not ready to toilet train, no matter what age they are. If they can be wet and dirty and show no sign of awareness that they are, you're probably not going to get very far with toilet training. If they are showing that awareness, so families often say, I can see on their face, or I can see them disappearing into the corner, they know they're going to have a poo, or if when their nappy's wet, they're pulling at it, even if they don't have the language, they're showing some indication, or even trying to remove the nappy themselves, they probably do have enough awareness to start toilet training, and we'd suggest doing that in the ways that normally would, just in a very low-key, relaxed way, trying to get the child to have a sit on the potty or on the toilet or in a special toilet seat. Sometimes that goes really well. Sometimes we find, because of the sensory issues that you have in children with autism, they find that quite distressing. So if the child is showing readiness and they're wanting a dirty or wet nappy removed, we'd get the family to try and sit the child on the toilet, and sometimes they'll do that quite happily. Another good way, which might sound odd to a lot of people, is children with autism often learn visually very well. So rather than being told to do something, is actually watching and copying. So if there's older brothers and sisters or older family members that don't mind being watched going to the toilet, often letting the child see them go, they will often copy, and that's another good way that children often learn at nursery, is that they see the other children going for toilet time and they want to be part of that and copy. So copying other people is often a good tip. If a child's getting very distressed by having their nappy removed and being sat on a toilet or potty and refusing, I wouldn't persist with it. You're just going to create more and more distress, and you're probably not going to get very far. But then we look at more specialised interim steps, such as sitting them on the toilet or potty with their nappy on, just to get used to it, and gradually doing little steps like that. But if you're running into problems like that, where there's readiness but you're not making progress, you probably need some more specialised help through your local team, maybe a psychologist on the team or occupational therapist who can help you with the toilet training. A lot of young children with autism toilet train out of nappies for a wee quite well, but insist on having a nappy on to go for a poo, and that's a very common problem that we see. And I explain to parents that that's because the transition from having a poo in a nappy to having it on a toilet is a very different feeling and a very different sensation. In the same way as if I suddenly put a nappy on you and asked you to go for a poo in a nappy, you would find that quite unpleasant and distressing. The transition the other way around for a child who's got used to doing that can be quite difficult. And again, that's often a staged, slow process. We use visual prompts such as stories. There's a nice PDF book that's freely available on the internet for children who are able enough to access it, called Poo Goes to Poo Land, which was written by a psychologist for families to talk about, go through that story. If they're less able, so the story isn't particularly interesting or motivating or not that level for them, that you can actually, again, use visual prompts, such as when they've got a dirty nappy, taking them to the toilet, seeing you tip the poo down the toilet, getting the connection that that's where the poo goes rather than in the nappy. And then sometimes it's a piece of sensory desensitisation work with psychologists working, getting the child over that transition from pooing in a nappy to pooing in a toilet. Other children I see get stuck for ages with the toilet training, and parents get frustrated and disheartened. They know they're ready, they're not getting it anywhere, and overnight it suddenly clicks in a way it doesn't do with children who are typically developing, where it's usually a period of weeks. Sometimes I've seen quite a number of children who've been stuck for ages, and suddenly something clicks in their head and they suddenly realise they need to go to the toilet, and it's done as easily as that. And occasionally with families we say, just wait and I think this will just click, and it does. So a child with autism only using certain toilets is something, again, we come across quite commonly. A lot of children with autism will learn to do a skill in one context and then not generalise it to other environments, like children who have typical development. So that doesn't just apply to toilet training. So they may have learned to use the toilet at home and be quite happy, but then don't realise that they can use a toilet in other places, and it often takes a little while and a little bit of encouragement to learn that. Sometimes the problems are different and there may be a genuine fear of public toilets, and particularly the noisy hand dryers in them. A lot of the children I see have sensory issues and particularly are distressed by the noise from hand dryers and won't even go into a toilet where it has an air hand dryer because the noise and the sensation from it's distressing. So it may be that families need to work out what it is about particular toilets. Is it the hand dryer? Is it the smell of them? Often the smell of school toilets or public toilets is quite unpleasant for anybody, but for children with autism where they have heightened sensory sensitivity, it's even more unpleasant, and that could be the problem. So it's unpicking about, you know, what is it that the child dislikes. Sometimes it works having their own little toilet seat that they can use at home, but then they can take it to other toilets, and that sometimes works. There's not a one-size-fits-all solution, but it's just about working out where the barriers are, looking into it a little bit more and then trying to problem solve. So it depends on, again, your local services. If you've got a preschool child and you think they're showing readiness, I would approach your health visitor first for advice. The health visitor then might have access to somebody more specialised, or a specialist continence nurse if they find that the problems that the child is having are specific to autism and they don't have the skills for that. For older children, again, I would suggest the school nurse in the first instance, who might have enough knowledge to help, and if they don't, could tap into autism specific services. If they're very specific autism related sensory issues, such as withholding and only passing stool in a nappy, or fear of particular toilets, I would then suggest that's probably the job for your local psychology services.